Hello, it's 11 a.m. in Seoul. I'm Kim Mo-gyun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Director of Health Policy Yoon Tae-ho will be briefing us on the coronavirus situation here in South Korea. He will fill us in on the number of new infection cases and what kind of efforts the government is making to contain the virus, especially with the spread of cluster infection cases seen in recent days. We're still waiting for the briefing. And just to give you a recap of the current situation in South Korea reported 235 new cases of COVID-19 on Tuesday, and this brings the total number of cases in the country to 20,182. The briefing is about to start right now, so let's take a listen.
Let us now begin our regular briefing on the COVID-19 response for September 1st, Tuesday. As of today midnight, we have 222 new local infections, and for 5 straight days we are seeing a slight decline in the number. And in the metropolitan area alone, we have 175 cases, which is below the 200 mark for the second consecutive day. However, until today, we believe that these are the effects of a decrease in the number of testings during the weekend. So we need to have our eyes on the situation going forward. However, we have seen some extent of outcomes and the results of our intensified quarantine measures in the metropolitan area. And considering that these measures are probably yielding results for the next one week or 2 weeks, we ask you to comply with these measures going forward. Fortunately, we had no additional fatality. However, we have a surge in the number of patients with severe or critical conditions, which now stands at 104, which is also double the numbers from the previous week. So we ask for your particular precaution. And right now in the metropolitan area, we only have 43 hospital beds available for the critical ill patients, and we have about 1,400 beds for the patients available nationwide. And we have a joint situation room which we utilize to admit the patients to the hospital depending on their level of symptoms. And starting from last week, we have secured 43 hospital beds for critical ill patients. And we also provided some criteria for the hospitals to provide them with a compensation if they provide these services to the public. And right now we have about 2,000 rooms that are available as for the life treatment centers, and we can administer about 1,000 patients at our life treatment centers. And the government going forward will also exert our full efforts to secure enough hospital beds for our confirmed cases. Today is the third day of our intensified quarantine measures in the metropolitan area, and starting from 23rd to 27th of August, we have seen a decline in the amount of mobile traffic, and this decreased by about 12%. And many of our public have partaken in our quarantine measures, defying their discomfort and inconveniences, and we would like to thank you once again taking this opportunity. And if we see such trends going forward, and if we can decrease the amount of foot traffic, that would be very great. And we ask the public for your continued support going forward. And we believe that we need to have a great results yielding from such measures, and we need to put them in short term and with higher intensity. And during this weekend, we ask you to avoid from having social gatherings and travel, and please come home directly after finishing work. And the government will also exert our full efforts to devise necessary response systems. And in response to the COVID-19, we have some plans standards for our social welfare facilities. And as for the heightening of the social distancing to level 2, we have been recommending all of the social welfare services to be on a halt for a temporary time being. However, we would like to minimize the caring gap as for those who are in the vulnerable classes. And as for the senior citizens, we would provide phone calls to check whether they are in great conditions, and we also will provide some lunch boxes to them as well. And as for the disabled, we would also utilize the monitoring systems through non-face-to-face means like phone calls and so forth. And as for children, we are providing emergency caring scheme, and we provide delivery of lunch boxes so that we can substitute our school lunch system. And as for the collective action taken by the medical practitioners, we have a few words of announcement. Many medical practitioners are taking their strike continuously, and we have great concerns from the public mounting. And yesterday, the medical circles have published a statement, and they also explained elaboratively that they are against the government's medical reform policies. And in relation to this, we have some fact-checking that are needed. Therefore, we would like to provide some explanation. First of all, the insurance, national medical insurance for the Oriental medicine, this is only on a pilot run for 1 year, and this will also be determined after the pilot run. And this means that we will abide by the National Public Medical Insurance Act, and this has been decided for as a result of 8 months of related dialogue and negotiations from about 24 medical experts from diverse fields, and we also have 2 medical practitioners also on this committee. And however, withdrawing such a pilot run defies our negotiations that we have made so far, and this also goes against the public need. And moreover, in order to have evaluation, they are calling for us to withdraw these pilot run even before they are fully operated. So we believe that this is irrational right now. And the public medical school is all about nurturing specified graduate school students in the fields of medical studies, especially for the regions that need more doctors and provinces as well. And we have been providing such a scheme under the legislation provided by the National Assembly. And we also already have pledged to make a consultative body among the political parties. And yesterday, we also got approval from the ruling party as well. This also, please note that this is closely related to the legislation as well. And as well as the details of the public medical schools will be decided going forward by the National Assembly, so nothing has been decided as of yet. So please note that some of the rumors that are spreading through the medical circles are just rumors that are groundless. And we would like to note that these measures are also outside the boundary of the executive branch, and they call for the implementation by the judiciary branch as well. And we would like to mention this clearly. And we believe that we have engaged in continuous requests to the medical circles to engage in candid dialogue with the government. However, there are some areas that the government cannot embrace right now. We believe that there were some areas that breached our jurisdiction. And also, please note, and we would like to ask the medical circles to provide a more clear stance. And right now, the government did not disclose clear plans and detailed plans for our medical school reform. However, we are also highlighting the fact that we are willing to sit down with talks with the medical practitioners. So if you provide some realistic options, we would like to engage in candid and practical dialogue going forward. Despite such concessions made by the government, the medical practitioners are continuously carrying out their walkouts, and they are putting at risk the safety and the lives of the patients. And please check the urgency of your collective action before anything else. Yesterday, President Moon Jae-in also has said that the government will also provide a consultative body and utilize the consultative body established by the National Assembly, and we will also engage in candid dialogue with the medical circles to reform our plans going forward if the coronavirus situation is stabilized. So once again, we would like to urge you to return to your respective duties. And in some religious circles, there were churches that carried out their face-to-face and physical services. And during the past weekend alone, we had about 200 churches that were reported by the citizens to breach such a measure. And we continue to ask the churches to abide by the quarantine measures in order to curb the further spread of the virus. Please note that these quarantine measures cannot become in harmony with the rights to religion, and we would like to ask you to continuously switch to non-face-to-face means, especially during the Wednesday service as well this week. And we believe that the utmost priority lies in the safeguarding of our lives and the public's safety. Therefore, if continued breaches are carried out, we will also be taking stern actions based on legal perspectives. And the government will also exert our full efforts during the next week or so in order to flatten the curve. And we ask you to exert a week of standstill and partake in our toughened social measures. And looking at the risk factors in the metropolitan area, it is very important for us to reduce the amount of physical contact with others. So we once again ask the residents living in the capital area to refrain from having social gatherings and to stay home safe and sound. Thank you very much.
That was the daily briefing on the COVID-19 situation here in South Korea. We've just heard there were 253 additional infection cases of COVID-19, bringing the total to 20,182. There were no additional deaths. The total death toll is at 324. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at 12 p.m. Korea time. Bye for now.